Mutahi, and today we're talking about family planning. So, can you write in the comment section and tell me how much you know about family planning, what the question you want me to answer, and I'll be there answering you. Remember to subscribe, like, and share, because the topic today is all about preventing ourselves. The most common things we do which can have a later side effect or a later complication. So let's talk about family planning today. With me I have the most commonly used family planning methods here in Kenya. But before you use them as a female or as a woman, remember to go with your partner so that you can hear or learn about side effects, because I've seen it in my practice that people come to get the family planning of their choice, but they have not informed the partner. So when the side effect arrives, that's when they come and they start complaining. So ensure that tag along your partner so that when he comes, he is able to know that my wife or my partner is going to get this side effect, or these are the side effects we are expecting, and doc said in case we see this we can go back and change, or we can do one or two. Okay, so let's start with the hormonal family planning. Remember, we have hormones in our body, so these hormonal family planning methods are just artificial hormones that are added onto what we have. So let me talk about, but before I go to hormonal or to other methods of hormonal, there's this pill called P2, and this is not a sponsored video. So there's this thing we call P2, or a tablet that we call P2. There are usually 2 tablets. This is not part of the family planning. This was meant to be used as an emergency pill only. Emergencies, just in case of rape. Because the other time we always know that we are about to do it. So let us not act instantly. Let us always be able to plan ourselves. So this is not a family planning. This was meant to be used as an emergency, and there is a purpose on to why it's called an emergency pill. For more, we will talk it in the later topic. Remember to subscribe so that when I post about the P2, you are able to get the updates. So let's talk about the pills that we have. With me I have Chaguo Langu, I have Microlute, and I have Femiplan. These are the most commonly used by 90% of the population that use the pills. So I'm going to start with the Microlute. Microlute is one hormone. It's contained one hormone, so it has a lesser dose, and it's an additive that you use to breastfeeding mothers to ensure that they are optimally planned so that they don't get pregnant. So this Microlute right here, it's a 35 daily dose. So you take each tablet on a daily basis, same time. So if you have started at 8 p.m, you will be taking every day at 8 p.m. Are we together? So it has a lesser dose, as we said, because when you are breastfeeding, there's something called lactational amenorrhea, which help us so that you don't get pregnant. But because it's not 100% certain, that's why we add. At 6 weeks, when the discharge is gone from giving birth, you are able to come back and start your activity again. By activity, I mean being intimate again with your partner. But before then, remember, you need to plan yourself so that you don't get pregnant again all too soon. This one will help you, and the good part about it is that it doesn't lessen your breast milk. Okay, so you are able to breastfeed optimally, and you're able to prevent yourself from getting pregnant optimally. Okay, so most side effects, headaches here and there, and you can get acne, or you can get body changes, like you can become plump, you can have spotting. Okay, but it has lesser hormone. Number 2 These are one and the same thing, only that they are from different company. This is called Chaguo Langu and this is called Family Plan. They are all 21-day cycle. But the difference is, this one, once you get to the 21st day here, as you can see, you have, when you are supposed to be having your menses, it has supplemental iron. So once you're having your menses, you can swallow the supplemental iron. That's why it's a bit costly than this. Okay, this is called Chaguo Langu. Chaguo Langu doesn't have supplemental iron, so you take the daily dose, and as we said, if you have started at 8 p.m. you have to take every day at 8 p.m. without missing any single dose, because if you miss one, you can be able to take the following day. You take when you have remembered, and you take the same time that you do. But if you miss 2 days, ensure that in that 1 week you have used an extra protection, or you abstain if you can. So what are the side effects of the pills? We said you can have acne, you can have spotting or intermenstrual bleeding, like you bleed between menses. It's not your time to have menses, but you're bleeding or spotting. You can have some weight gain, a little. You can have acne, depending on your body. Changes come depending on your body. So ensure that you take these pills the right time. So most of you will ask, when I stop using, when can I become pregnant again? So when you stop using the oral contraceptive pills, all of them, between 1 to 3 months, you are able to get back or have you can be able to conceive. That is what we are calling return to fertility. Okay, number 2, we are going to talk about another misused product right here. This is called Depo. I know most of you know this. This, you're injected and it goes for 3 months. You can either be injected on the thigh or on the hair, on the arms. But remember, every 3 months you get an injection. So let's dive into it. What's the content? The content is 150 mg. This is what you ingest, or this is what is administered to you once you come to the facility. And once you administer, it's going to last you 3 months. And remember, it's 150 mg. So with this, every 3 months you're getting 150 mg. And the most common side effects are, 1, you can have weight gain. You can have high blood pressure with this. You can have spotting, or you can have bleeding, intermenstrual bleeding, or you can fail to get menses at all. Sawa. So once you use this, you are able to use it for quite a long time. If you use it for quite a long time, return to fertility is going to get delayed. If you use it quite a short time, return to fertility is estimated between 6 months to a year. But remember, people get different effects, okay, or reactions to every medication. So for this one, it's known for its notorious act of prolonging return to fertility. So because of the high dosage or the high content dosage that you get. So remember, go get trained and use the right one that fit for you. So with me, I have implants. They are also hormonal methods. There are 2 types. One is called Implanon, the other one is called Jadel. For the Implanon, it will last for 3 good years, and for Jadel, it has 2 rods, it will last for 5 years. So with this Implanon, it's not big like this, by the way. It's just a simple rod like this, which is inserted right down here on the arm, either on the right or the left arm. So once inserted, it's able to last for 3 years. The mode of action is the same, only that for this one, Jadel, will be inserted 2 and it will last for 5 years, okay? But you can remove them in between the time you want to get pregnant. So let's start with the Implanon. Implanon has 68 mg. Okay, the dose is 68 mg, which is lasting for 3 years, and it's inserted right here. Then you remember why I talked about the notorious one that you get injected every 3 months, and it has 150 mg, and it lasts for for 3 months. It has 150 mg. So remember to always check the content. So this 68 mg is lasting for 3 years. Okay, then we have the 2 rods that are inserted down here. They are called Jadiam. Each contains 75 mg, so they have 150 mg. So the 150 mg, you are able to have it for 5 years. So what are the side effects? As we said, with hormonal content, reactions might be different. You might have spotting, you might not get your periods, okay? You might have intermenstrual bleeding, or you might have the hormonal changes like acne, headaches. So remember to always find out the cause before you say that, oh, this hormone has caused me a hormonal imbalance. All right. So the other things we're going to talk about are the most commonly things that we have that are used but are not hormonal. They are non-hormonal, meaning that they do not have hormones. We have 2 in Kenya which are most commonly used. One is a condom. This is not a paid partnership, okay? So we have a condom, and number 2 we have Copper T. So for Copper T, it lasts for 10 to 12 years. It can stay in the body for 10 to 12 years and protecting you maximally. But remember, no contraceptive or no family planning is 100% sure. But when used the right way, it can protect you optimally, okay? So it lasts for 10 to 12 years. And this condom, just use it once, you discard, okay? The reason I don't have other like female condom is because they are rarely used here in Kenya. So how does coil work? I have a model of a uterus right here. So remember, anything that opens your uterus or your cervix towards that part can assist an infection. So remember, the hospital that you're going to, or the healthcare provider that you're going to, has to be a hospital which is neat. The equipments are sterilized, and you yourself, you also have to maintain or check out your hygiene and ensure that once this one is inserted, you don't go out sleeping or being intimate with other men, because you don't know who is carrying what. Remember that. We will get to answer that, why I have said that in that manner. So remember to carry your partner so that you get to understand that this requires us to be faithful, okay? Because it will leave strings hanging outside. Let's see. On this model, so this is the uterus right here, this is the cervix. So when you come for it being inserted, you're going to prepare all the equipment and such, and make sure you use the sterile place and sterile equipment. So once it's inserted right here through the cervix towards the uterus, and once right here we release it so that it can block the entrance to the tubes. So once we do that, there's this string that is left hanging right here. We usually trim it and we arrange it right here on this curvature of our human female reproductive system. So this string, once you are infected or once the area is contaminated, can ascend any bacteria towards this and can cause tubal blockage later in life. So ensure that the hygiene is properly maintained. Ensure that you don't contact STDs, because your cervix has some opening, or there is something that can ascend the infection, making you get a pelvic inflammatory disease. So once inserted, it's able to protect you between 10 to 12 years, but you can remove it anytime you want. Remember that anytime you want to, you feel like I'm ready to get kids, you can remove it. If you maintain hygiene properly and you have ensured that it was inserted the right way through your trusted healthcare provider, once removed, you can be able to conceive immediately, okay? If you are ovulating, that is, or return to fertility is within a month. That is the good part about non-hormonal. This one, immediately you remove it, it's immediately if you're ovulating, okay? This one within a month if you're ovulating, all right? Or immediately if you're ovulating. So remember, when going to check which family planning method you're going to choose, always make sure, sit down with your healthcare provider, make them explain to you one by one, explaining them to you the most common question you need to ask. What is the content, okay? If I use it, how long will I stay? The period of protection. Then number 3, return to fertility. If I stop using it, okay, how long will I stay for me to get a child or to conceive? Then from there, what are the side effects? So that when you feel them, you don't come saying, I've seen something which I'm going to talk about in the later date, about something called hormonal imbalance. That common term has become totally misused. Okay, so we are going to talk about hormonal imbalance in our next session. So remember, subscribe, okay? Remember to like and share. And the reason I'm telling you to subscribe, it's because I want you to get all the information that you need about preventative care. Ask me any question down below and I'll be sure to answer that. Bye bye.